Nursing 4580 Practicum Synthesis of Professional Nursing Capstone and 5-Year Plan Presentation RN to Baccalaureate Nursing. Hello everyone, my name is Elizabeth Reyes and I am an RN. I am currently the Assistant Director of Nursing at a continuing care retirement community. I have 14 years of long-term care experience. My experience started as a CNA in 2005. I worked as a CNA for 5 years and then started my nursing career. I have been a nurse for 10 years and I just got into management 3 years ago. So I am new to the management field. I am currently in the BSN program, but my goal is to pursue my MSN in administration. The human and society construct was met through the following assignments. It was met in the Comprehensive Holistic Health Assessment, Nursing 4316. The assignment included a discussion on influenza. The influenza assignment included the prevalence, the nature of the problem, global prevalence, and organizations addressing this issue. Lifespan health continuum construct. Preventing disease, maintaining wellness, and promoting and restoring health, advocating for death and dignity. This outcome was met in Nursing 4620. The assignment consisted of a community service-based learning PowerPoint. It was based on a 69-year-old female status post-hospitalization related to diabetes complications. Discussed were treatments, prevention, and resources available for this individual. Evaluation of patient-centered care across the lifespan. This outcome is met in Nursing 4580, Synthesis of Professional Nurse Capstone. The assignment was based on a group discussion involving an infant with a medication error regarding a lethal dose. The discussion included contributing factors and ways to prevent this issue from occurring again. Evidence-based practice clinical reasoning construct. This outcome was met in Nursing 4316 Comprehensive Holistic Health Assessment. The assignment was related to Healthy People 2020 objectives. The paper done was based on reducing, preventing, and eliminating healthcare acquired infections. Cultural, affects, and educational obstacles were discussed. Discussion also on evidence-based practice guidelines in reducing, preventing healthcare acquired infections. Professional roles conduct. Differentiate role dimensions and practices within legal, ethical, regulatory parameters. This outcome was met in Nursing 4580, Synthesis of Professional Nurse. A group discussion was discussing the Lewis Blackman story and his death. The issues addressed included legal, ethical, safe, and effective care using parameters of the Texas Nurses Practice Act. Demonstrate professional integrity, effective communication, active inquiry, service to community. This outcome was met in Nursing 4540, Care of Communities. With this assignment, a teaching plan was created using best practice guidelines. The teaching plan was based on a disaster preparedness plan for a risk of aggregates that included teenage boys and how to implement a disaster preparedness plan for these individuals. Patient client-centered care. This objective was met in Nursing 4313 Comprehensive Holistic Health Assessment. A patient-centered care plan was created for a 58-year-old male experiencing chest pain. The nursing process was guided using human systems model theory. 5-year career plan. My next step is to obtain my MSN in administration. While working on obtaining my MSN, I plan to acquire hospital experience working PRN. As I stated earlier, most of my experience has been in long-term care. I feel with me obtaining hospital experience, I will be more knowledgeable. I also plan on obtaining my wound care certification and becoming MDS certified to better fulfill my role. Overall, once my MSN is obtained, I plan to become a nursing facility administrator. I believe an administrator with a nursing background can be of benefit. With working in long-term care for such a lengthy period of time, I have worked with several administrators, and some have been nurses and some do not have a nursing background. I believe the best nursing administrators have that nursing background, which is why I am going this route on my 5-year plan. References used in the creation of this PowerPoint included the Texas Board of Nursing 2012, the RN to BSN Student Handbook, as well as referencing previous courses and course material.